Hello, my name is Jessica Irwin. I am a Bachelor of Science in Nursing, a recent graduate from Azusa Pacific University, and today I want to talk with you about how to excel at your spiritual assessment. The reason I wanted to make this presentation for you is because I was once in your shoes. I was once a nursing student who was completely overwhelmed when my patients would ask me questions that were really difficult to answer. I didn't respond in the right ways. And throughout my nursing program, I learned that our response to our patients isn't only important for our ability to feel competent in our nursing care, but really it affects our ability to connect with our patients and make trusting relationships that help them heal and get better spiritually. So that is one of the main reasons I made this video. I also made this video because while I was a student, other students would come to me and say, why the spiritual assessment? Is it just because we're at Azusa and this is a Christian school? Well, I'm here to tell you that this is important across the board. It has been adopted by hospitals to include a spiritual assessment with every single patient, regardless of their religion and their background. So yes, this is essential. I'll be talking more about that in this video. I also wanted to make this video because I personally went through a tragic situation with my husband where he was a victim of a hit and run accident, and his care in the hospital really didn't include any spiritual aspects, and it made it difficult. And the one nurse who did include a spiritual assessment in her care with us was the one who really made a difference to us. So through my experiences with other students and my experiences as a student myself and with my husband, I realized that nurses need to know that this is important and they need to develop this area and this language in order to really succeed with their patients. So let's go on. So here are a few questions that you may face in the hospital. There are going to be times when your patients are going through difficult things and they look to you for answers. They may ask you, why is this happening to me? Am I dying? Am I going to be okay? Why should I even live? I'm just a burden to others. What did I do to deserve this? I know what you're thinking. I can't answer that question. There's no possible way to know how to answer this. And for the most part, you're right. What our patients need more than us fixing them or us giving them the answers is for us to be able to ask them the questions that open their hearts and open their minds in order to heal and to know what they're going through. Throughout this video, I'm going to be teaching you different strategies. I base my teachings off of a book called What Do I Say? Talking with Patients About Spirituality. This book is by Elizabeth Johnston Taylor, and I believe she did a good job at beginning to give us a language for how we respond to this. We're also taught in nursing school how to be effective listeners, active listeners. But what happens when listening hinders and silence makes our patients feel uncomfortable? What do we say? How do we respond to these difficult questions? Well, let's continue. So why do we give spiritual care? Well, when our health is threatened, our spirits can be threatened as well. Recent Gallup polls indicate that 91% of U.S. adults believe in God or a universal spirit, and 81% of people consider religion to be important. 94% of patients believe that spiritual health is as important as physical health. Now that is so huge. 94% of our population, regardless of their religion, believe that their spiritual health is as important as their physical health. So we need to be paying attention to this. 40% of patients use faith to cope with their illness. And like I said earlier, the Joint Commission now requires that a patient has a spiritual assessment upon admission, regardless of where they are and what religion they are. So there are some benefits to giving spiritual care. It is not only good nursing and good care, but it is good science. Opening up and sharing emotions has been found to contribute to both physical and spiritual healing. Our ability to cope with our difficulties spiritually provides adaptation to our illness and allows us to be able to get through the difficult times. I like this little quote. It says that finding meaning in life events, demonstrate individual purpose, and live a life that reflects your values and beliefs. Now that is spiritual wellness. Well, we want our patients to be good at this. Some of you may be thinking, okay, spirituality, religion, how are they different? I found a little YouTube video that talks about how spirituality really is what brings meaning and hope and purpose to a person, where religion is just one outlet of spirituality. So let's take a quick look at this little video, and maybe this will clarify this for you.
Spirituality in healthcare has become a key research centre for the university and a key area of research for the university. But when we say spirituality, we're not talking about religion here. What exactly are we talking about?
No, I think that's why a lot of health and social care practitioners turn off when you talk about spirituality, because they immediately think we're thinking of religion, and probably in their training what they were taught about was, when we're thinking about spirituality, we do a tick box and say, what's somebody's religion? Do they need special needs for food or culture and things like that? But that's not what spirituality is about. For some people, religion may be what informs their spirituality, but that will be a smaller number. For the majority, it's about what gives us meaning, hope and purpose in life. And that's really important, especially when we start to think about how do we deal with illness, how do we deal with crisis, because those sort of things impact our ability to know how to cope and to think about, why has this happened to me, what's going on here, and when it comes to terminal care, this is the end of my life, what am I going to do? And spirituality becomes very important in times of illness.
So it helps the patient, basically, in simple terms. It gives them a new reason to be, a goal to drive.
Yeah, I think certainly the research talks a lot about that patients want to talk about spirituality, and what tends to happen is that healthcare workers and social care workers don't know what to say, that they think it's going to be something deep and philosophical, and actually it's about basic communication. It's about connecting with a patient and listening to what their concerns are and trying to help them find some meaning and hope and purpose in what's going on for them.
So what you're saying is a lot of healthcare workers sort of shun it a little bit, more out of nerves than anything.
Yeah, I think certainly the research again talks about that health and social care practitioners see spirituality as something that is important for patients, but they don't know what to say, and they don't have the confidence in knowing what to say, and think if they start these conversations it's going to take hours and hours and tie them up in knots that they don't feel comfortable about. The other thing is that in the media there has been cases over the years of people being suspended for talking about their religious beliefs. So again, because health and social care practitioners think that spirituality and religion are the same, they think, well, actually, if I do that, I might get into trouble with my nursing board or the GMC, those sort of things.
And you're looking to introduce this into the curriculum here at Huddersfield University and the nursing students here. And it goes further than nursing students, doesn't it?
Yeah, it goes much further. And it has been integrated into some curricula over the last 10 years. And certainly looking at the guidelines for nursing, occupational therapy, and some of the other allied health professions, it is in there. And it's certainly in the knowledge skills framework talks about addressing patients' spiritual needs. I think what happens, though, is that it doesn't say how do you do that. And so some people think if I've asked them about their faith, then I've ticked that box. But they don't realise that spirituality is different to religion. There can be some overlap, but it is something that all of us have in our lives. What gives all of us meaning, hope and purpose? So for some people it might be their relationships with their family, with their grandchildren. It might be with nature, it might be pets, it might be what they do day to day in terms of hobbies that gives them meaning and purpose. It might be to do with their work, and it is something that does impact us all.
And are students beginning to, is it something that students begin to realise they need in their toolkit?
The sessions that I've done with students, the first question I get them to consider is, what is spirituality? And we have a 10-15 minute debate on what it is. And then we talk about some of the definitions and maybe think about some of the case studies. And at the end of the session, they always say, oh, that seems so much better. That's much more practical. I thought it was more complicated than that. And it is, spirituality is intensely practical. And I work in primary care, so I have 10 minutes with a patient, and in that time it's to assess, diagnose and treat somebody. And if you think about spirituality, it's not something separate, it's throughout that consultation. It's how I welcome the patient, it's how I listen to them, how I connect with them and support them, especially in terms of difficult diagnosis, listening to what their concerns are and spending the time in what nursing we call presencing, so being fully there with my patient to support them in their journey. And that doesn't take hours, and it's not rocket science.
All right, so that's just a little tidbit that I thought was super helpful. And just to kind of clarify, what is that difference between spirituality and between religion? I want you to take a minute to pause the video. I want you to grab a piece of paper and a pen. And I want you to go back to these questions. Maybe take one of the questions that maybe you've heard before, and I want you to see, with the tools that you have now, how would you respond to this? What is something that you could say to your patients? At the end of the video, we're going to write down some of the things we've learned. So let's go ahead and let's take a minute to pause. All right, let's go ahead and continue. Another aspect in being able to give spiritual care to our patients is knowing how to prepare ourselves against compassion fatigue. It is a big topic of conversation in nursing, when nurses can burn out, going through so many difficult things over and over. When we're not prepared for them, they can cause us to have emotional breakdowns as well. Even when we are prepared, it's difficult. As nurses, we have to learn how to pause, how to rethink, and how to know when to stop so that we can take time for ourselves. There are going to be moments when we feel helpless in our role as a nurse, and nurses often internalize those difficult things because they feel that they need to be tough. But being overwhelmed by tragedy and feeling like you can't make a difference to improve someone's life will only add to your potential for burnout. So let's see if we can't prepare for these difficulties and understand how to prevent compassion fatigue by being able to be faced with these difficult questions. Many nurses feel incompetent, and nothing leads to burnout faster than incompetence. So what can we do? The next steps in this video, we're going to go over practical scenarios, case studies of people with real life situations and real life questions. We're going to be able to assess where they're at, what they're feeling, to understand maybe what's going on and have insight, and then also what interventions we can do, what we can say to help them. So where do we begin? In order to give this great care to our patients, we need to understand what our personal beliefs are. We need to do a self-assessment. Nurses with a strong sense of their own spirituality are so much better at providing spiritual care. Attending to our own spiritual needs in our inner life really allows us to be aware of the inner lives of our patients. So once we have a value for those experiences and a value for the difficulties that we've faced, it really allows us to listen and respond to our patients in a way that's healing. I want you to ask yourselves, are you really comfortable in giving spiritual care? It's not an easy thing to be comfortable with. It takes so much time. I made this video so that we can just begin to see how life could be comfortable in these difficult situations without having to completely shut ourselves off and become numb. I feel like so many times as a nursing student, I was faced with instructors or preceptors that would tell me, oh, Jessica, you just need to toughen up. Don't be so emotional. And I felt as though my feelings were completely shut down. There are areas that I need to toughen up in, but I know that when I'm educated, my insecurities fall to the wayside. So I wanted this video to be able to help you and give you some confidence in this aspect of spiritual assessment. So how do we build rapport with our patients? We need to maintain comfortable eye contact. We need to face our patients. We need to be able to let them know that our bodies match what we're saying. We need to be able to give them a 90 to 180 degree angle in order to have our bodies in front of them, and we need to match their body language, their mood, their voice. This is as simple as going into a room. Maybe you're so excited for this day to start and you pop into a room with your bubbly attitude. You're like, hey, how's it going? And you want to go and give that patient a high five, but you notice that your patient is curled up, is not responding to you, and seems like they're spiritually compromised. Well, one way that we can respect our patients and build rapport is by matching them. Be slow to rush into a room. Open the door slowly. See where they're at. If they're speaking softly, talk softly. If they're speaking loudly, join on in. But try and match how they're feeling. Another thing we can do is to comment on the things that we appreciate about the patient or their belongings. This is something we do in our little spiritual assessment portion of our care plans, is we go through our boxes and we check off if they have photos of family present, if they have other items, any religious items present. This is where you can see something and you can start to connect with your patients, commenting on things that you like about their uniqueness and their ability to cope with their situations. Maybe it's something as simple as, wow, your glasses are really beautiful. Or, oh, is that a picture of your granddaughter? Tell me about her. Things that can allow you to connect with them and let them know that you appreciate their individuality. Another thing is to remember that we help our patients cope with spiritual distress and emotions even when we don't talk about spiritual things. So let's gain this language. Here is an example. You enter the hospital room of a woman you've never met before, who's just been diagnosed with a terminal illness. She has no one at her bedside, and you find her curled up in a ball, eyes shut, with the covers pulled up to her ears. How would you approach this patient? What would you say? Well, in order to respond and recognize to what she's going through, maybe we would go into her room, we would sit next to her within a 90 to 180 degree angle, we would look at her, and we would introduce ourselves. Hi, my name's Jessica. I'm going to be your nurse today. I heard that you've received some bad news. What are you thinking? One of the greatest things that we can do is ask open-ended questions. Being able to match their tone will help us to be able to connect with them and to let them know that we really care about what's going on. In order to be able to recognize what they're feeling and have a healthy response for it, we have to try and clue into our patient's innermost feelings. We don't need to have similar experiences as our patients to be compassionate, but we do need to have similar emotions. This is something I've learned early on in communication, therapeutic communication, is being able to understand and empathize with people. For some of us, empathizing is easy, but for others, it can be difficult. Maybe you've never had a terminal illness diagnosed to you, but maybe in that moment, your patient is feeling helpless. Has there ever been a time in your life where you felt helpless? Where there was a task ahead, but there was no way that you could complete it on your own? Having that underlying similar feeling allows you to be able to connect and maybe recognize what your patients are going through. Here's another example. You have a patient who's a 22-year-old male with a spinal cord injury and says to you, "I know I wasn't wearing my helmet when I was riding my bike, but why didn't God protect me? It's like, seriously, I'm so mad I could explode. I ruined my whole life." What is the feeling that this patient may be having? Maybe this person feels guilty and angry. I can think of a situation where I backed my car into a pole and I felt like the stupidest person in the world. I was so upset. I just completely exploded. I couldn't believe that I would do something like this to myself. I was going to have to repair my car and pay for the damages, and it was going to be so expensive. And I was so upset. That underlying feeling of anger that I had done something allows me to be able to connect to somebody like this patient who may be also feeling angry because of something they did to themselves. Here's another scenario. You have a patient who has terminal cancer, and the patient's spouse is in the hallway and says, "I'm doing my best, but it doesn't seem to be doing anything. Doesn't seem to be good enough. I just don't know what to do. I can't stand to see him suffer." What is this family member feeling? Maybe this family member is feeling helpless, like there's nothing that they can do. Has there ever been a time where maybe you felt helpless in a situation? Being able to have those similar feelings, again, allows us to empathize so that we can understand what our patients are feeling. Like I mentioned before, silence is helpful. Being an active listener is essential to being able to give great care. But when do we speak up? Because that silence can sometimes shut our patients up and make them feel uncomfortable or make them feel like we don't care. As nurses, we also have thoughts that can undermine our ability to be able to give this care. We think, "I can't do anything about it, so why even try? If I talk about this tragedy, the patient may fall apart or be destroyed. I don't want to be there for that. I can't handle that. I wasn't trained for that. I'm not a psychologist." Or maybe, "I will be destroyed if I hear about this tragedy. I'm sensitive right now. I'm going through a hard time. I don't think I can handle one more thing today." It's important to know the reasons behind our responses to our patients. It's important to know when we need to stop and walk away and ask for a new assignment. But it's also important to know that we do have the skills that are necessary to care for our patients. I want to go through the no's first of all. I want to show you what not to do, because I personally have done so many things from this list, and maybe you will be able to relate as I go through them. Changing the subject. Maybe you walk in a patient's room and she said she's just been incontinent in the bed and said, "I can't believe I just wet the bed. I'm so embarrassed." And you look outside and say, "Wow, isn't it a beautiful day today?" Maybe you're uncomfortable with what your patient says, so you decide to change the subject. We all do it. Or maybe you say something funny to lighten things up and use sarcasm. Maybe your patient was incontinent and had a bowel movement in the bed, and you say, "Oh, don't worry about it. I deal with poopy things all day long." Well, that sarcasm could offend your patient, and it's only going to help you. Because you're feeling uncomfortable, you make a sarcastic comment. But really, your patient may need you to listen and to help them understand what they're feeling. Another thing we do as nurses is we impose our solutions. Nurses are the best and the worst at this because we want to help people. We want to fix their problem. But most of the time, we're not going to have the answer that our patient is looking for. So, we need to be a helper and not a fixer. We need to allow our patients to discover what's in their own tool belts so that they can deal with this when we're not present. Another things we might do is avoid our patients or family members who look distressed. Maybe you walk by a room, or maybe you've even heard in passing that a patient is really difficult or really depressed, and you just like, oh man, I don't want to deal with that. So you just ignore them. This really doesn't help them. Another thing is stating why questions. Somebody's like, man, I'm really feeling down today. And you just say, oh, why? Well, that is only going to cause them to dig a deeper pit of depression, so we do not want to ask why questions. Another ineffective response is giving a false sense of hope. Man, this is a tough one because I have done this so many times. Maybe it's preoperatively with a patient who's getting ready to go in for a cardiac catheterization, and all of a sudden they look at you with these beady eyes, and they're so scared, and you know that there's a question coming up, and they're just like, man, like, have you been through this? What's going on? How, is this going to be okay? And you look at them and say, everything is going to be just fine. The doctors here, they are great. They will fix the problem, so don't even worry about it. Well, all that's doing is pushing aside their feelings and giving them a false sense of hope because you don't know what's going to happen in the operating room. And that patient might come to you if there's a bad outcome and say, you told me everything was going to be okay. So we really need to be careful on how we respond to our patients in these difficult times. We need to consider that what our patient is feeling and to see if they appear threatened or defensive. If we don't have our patient's heart, they're not going to trust us to be able to listen to the questions that we're going to ask them. So that is when we need to realize that silence is the key. We also need to recognize that spiritual care is based on our patient's needs. We need to try and set aside our own agendas to really get to the root of what our patients need. If they're not open to talking about spirituality, then we can't force it because solving their problems or correcting or eliminating their spiritual suffering and converting our patients to our ways of believing, it's inappropriate and it's an unrealistic goal. What we need to do is ask questions. We need to allow our patients to come up with the answers, and we need to accept that tears are a sign of healing. The chemical qualities of tears has actually been studied and shown to have healing properties. So let's just accept that as a sign of healing. So let's go back to our examples. We have our spinal cord injury patient. He's going to be the focus of our case study today. And he comes to you and makes this statement. He says, why live? What do I have to offer being a quadriplegic? How do we respond? Well, we could use a restatement, and it sounds like this. It sounds like you're having difficulty finding purpose to your life in this situation. A restatement simply takes what our patient says and flips it around to give it meaning and understanding to the patient, because maybe they don't even know why they're saying it. We also, like I said before, need to ask open-ended questions. Something like, what brought that question to mind? What is going on beneath that question? Another thing we can do is reflect on feelings and say, it must be difficult adjusting to your new situation. What concerns do you have? Maybe this patient is concerned that they aren't able to do things that they were able to do before. Or maybe our patient is just upset or feeling sad. By asking them these questions and asking them to reflect on their feelings, our patients will begin to understand what's going on and help to bring meaning to their situation. Here's another statement. I'm afraid that I will be helpless and suffer. Why would God let me suffer? What do you believe? Another response that we could have is something called self-disclosure, where we share a little bit about ourselves. We might ask a question like, I don't mind sharing my beliefs, but what in particular would you like to know? Maybe this person is asking about our faith and our faith statements, or maybe this person is asking, why would God let this happen? So we need to make sure we understand what our patients are talking about. And the only way to do that is making sure with a clarifying question. Sometimes the answer to this question may just simply be, I don't know. And that is okay. But it is a response. It's not silence. Also, keep in mind that we need to keep it short. Our ability to communicate our feelings only helps us grow. So we need to keep our responses short so that our patients can communicate what they're feeling so that they can grow and heal. We do not need to disclose our own feelings to gratify our own needs. And that's something we need to be careful with. Here's another statement. Our spinal cord patient states, I just can't believe this is happening to me. A month ago, I lost my mom. Last week, I found out my son has diabetes. How am I supposed to handle all of this? Well, our response can be something that helps our patient find meaning, such as, I hear that you have had a lot of difficult things happen to you lately. How have you dealt with these difficult things in the past? That is one of the top questions that I have in my tool belt. How have you dealt with these types of things in the past? When we allow our patients to discover their own means of coping, it really helps them to get through difficult times. We also need to recognize that we may have a counter story, but we do not need to share it. I did this so much when I was a first nurse because I thought that my relationship with my patients was supposed to be like the friendship relationships that I had with my friends, where they had a problem and I would tell them how I had a similar problem and give them my solution. Well, this is not a professional or effective response for our patients to grow because that only helps us to grow. So when we have a story, maybe when you heard this patient talking about their son with diabetes, you had a thought of a family member with diabetes and you were thinking, maybe I should tell them about how my mom was just diagnosed with diabetes and how we're getting through it because we can handle it. Well, even though that may be helpful for you, this hasn't been shown to be effective with our patients. So let's save our stories and let's allow our patients to open up. Another effective response is nurturing resilience. So here's another statement from our spinal cord injury patient. I just feel so alone. No one understands what I'm going through. So many patients that I've faced have had this statement. I just feel like nobody really cares or understands what I'm going through. So how do we respond? Initially, when I heard this statement, I'd say, well, I care about you. But what I needed to realize is that the underlying feeling of loneliness that a patient may have is only going to be counteracted and to be dealt with when we allow our patients to recognize the resilience in their own coping mechanisms. Saying something as simple as, is there somebody you feel safe talking to? Maybe you haven't developed a trusting relationship that's really solidified yet. So we have to ask, is there somebody that they do feel safe with? Maybe it might pop in their mind and they might go, you know what? I haven't really called my brother yet. He's usually the one that I talk to about stuff. And you're right, I need to talk with him. Maybe it's something as simple as that. Another thing we could ask is, how has this experience affected your beliefs? Maybe we want to go deeper with our patients and see how are they feeling? What are they thinking? What's going on inside of them? Another statement that nurtures resilience is, what do you want to accomplish with the life that you still have? Maybe it's as simple as allowing ourselves to recognize the strengths in our patients so that they know that they are not a piece of dirt, that they are not somebody who can be thrown to the wayside, that there is importance in their life. And so we as nurses have the incredible gifts and ability to recognize the strengths in our patients and to comment on it when the time is appropriate. Another statement by this patient may be, you know what, I'm ready to start doing things again. I just saw a video of a quadriplegic man who painted with his mouth. I doubt that I will be able to do anything like that, though. So how can we respond to this? Something I mentioned earlier was finding the strength in our patients, saying something like, it is so impressive to see how you're persevering. You could have just chosen a lazier response, but you didn't. Thank you so much for showing me what perseverance really looks like. Stating the strength of your patient will help them to be confident to face difficult situations. Maybe it's just even saying, wow, you are so strong. I believe that you will do something and you will accomplish your goals in the future. We could also respond by reframing, maybe saying something like, perhaps this experience will give you an opportunity to find new talents that you never knew you had. Stating an optimistic, reframing response could allow our patients to open their minds to new possibilities so that they can have new hope and new meaning to deal with this difficult situation. Lastly, I want to talk to you about prayer and meditation. I realized this being a Christian university that I was studied at, I was faced so many times with different students, classmates, who did not have the same faith or beliefs as I did, but they wanted to know how to pray or meditate with their patients. So, because I've had a lot of experience in this, I am a pastor's daughter, and I was taught how to pray for the age of 2, and I'm still learning to this day, but I feel like I have a lot to offer in this. When students would come, I even had students who were Buddhist or Jewish come to me and ask me how to teach them how to pray with their patients. At first, I was scared because I didn't want to offend them, being from different religions or even sometimes no religion at all. So I really thought about it and I personally prayed about it. And so I have this little breakdown for you and what I think is most appropriate when dealing with patients of different religions. Simply, if you're comfortable, ask your patient, would you like me to pray for you? Don't just jump in and pray for somebody and start praying for them without asking them, because you may offend them and you're somebody that they're going to have to be dealing with for at least the rest of the shift. So make sure you ask them, would you like me to pray for you? If the answer is yes, then go ahead and find out what their spiritual needs are, what their resources are, and what their preferences are by asking statements like, what is your religion? What would you like prayer for? Sometimes what our patient wants prayer for is totally different than what we think they need prayer for. For example, let's say we have our patient, our spinal cord injury patient. Maybe we think that they want prayer for healing, but in reality, they really want prayer for comfort. It's so important that we do our nursing assessment, that we start with an assessment. How can I pray for you? What would you like prayer for? What is your religion? Is it okay if I pray in Jesus' name because that's my religion? Or how would you like me to pray? Understanding that our patients come from different cultural backgrounds is so essential at being effective in giving them spiritual care. We need to make sure that we ask them if we're going to touch them. I think that as nurses, we're so invasive in people's lives that they just expect that we're going to move around the sheets and touch them and poke them and prod them. But even with something as simple as prayer, we need to ask them if we can touch them, if we can hold their hand, and not just assume. And then I'm going to go through a little step-by-step guide on how to pray based on my beliefs, because I can only share with you what I do. I can only practice what I preach and preach what I practice. So, from the Judeo-Christian approach, we start with prayer by thanking God for what we have. It says in the Bible that we enter the courts of God with thanksgiving and praise. So in order to enter into prayer, we thank God for what we have. Maybe it's something as simple as this. Dear God, I thank you so much that I get to be with my patient today. I thank you that I get to be here to comfort them. And we thank you, God, that you are here, that you told us that you would never leave us, that you would never forsake us. We trust in your words, God, and we thank you that you are with us. That is a simple thank you. Next, we're going to present the patient's request to God and sound something like this. God, we thank you for this time. And now, God, we just ask that you be with us, that you comfort this patient, that you would be there for them, that you would show them what you have for them in this time, and that you would be protecting them. Be present, Lord. Maybe that is your request. Another thing I want to say about prayer is that we need to be sincere. We need to sound like the person that we are. I put it like this. If you're going to call God on your cell phone and you're going to use a different voice, he may not recognize you. So we don't want to question whether or not God recognizes our voice. So don't try and sound like somebody else that you've seen on TV or you've heard on the radio. Be you. Use your words. Be sincere. Not only do I think that it helps us in our relationship with God, but I know it helps us in our ability to be present with our patients. If we're sincere with God, then we can be sincere with our patients. And lastly, we want to close the prayer with a thank you. We want to thank our patients. We want to thank them for this opportunity, and we want to close our prayer based on the responses that they gave us. So for me, being a Christian, I close with, in Jesus' name, amen. I believe that there is power in praying in the name of Jesus. But maybe you aren't comfortable with this, and you can simply say, thank you. A thank you is an effective way to let your patient know that you are present and that you will be there for them. Well, thank you so much for your time. If you have questions, please feel free to email me at the email listed below. I want to take this moment as well to have you pause again and go back to your little sheet and write an additional response to your patient. Something maybe that you've learned in the past 30 minutes that now that you can use if you're ever faced with this question. I also urge you to take time after your post-conferences, after you've worked your shifts at the hospital, to think back on questions or things that patients presented to you. And I'd like you to write those things down. Write down your response in the moment, and then write down what you would have done differently. This will only help you grow in your ability to give effective spiritual care and be able to really assess your patient's spiritual needs to be an excellent nurse. Again, thank you for your time. Here are a few references if you want to look up the background to some of this information. And I pray that you would have an excellent remainder of your career as a nurse, that you would grow in your ability to provide spiritual care, and that you will get the tools that you need in this time, that your stress would be relieved, and that you would become the nurse that you desire to be with God's strength. In Jesus' name, amen.